Ear lobe reduction, also known as otoplasty, is a surgical procedure to reduce the size of enlarged or stretched earlobes. It is a relatively common procedure that can be performed in an outpatient setting under local anesthesia. There are several reasons why someone might choose to have ear lobe reduction surgery. Some people are born with large or elongated earlobes, while others develop them as a result of wearing heavy earrings or piercings. Ear lobe reduction can also be used to repair earlobes that have been torn or pierced. The procedure typically involves making an incision in the back of the earlobe and removing a wedge of tissue. The incision is then closed with stitches. The surgery usually takes about 30 minutes to an hour, and patients can go home the same day. There are some risks associated with ear lobe reduction surgery, including bleeding, infection, and scarring. However, these risks are generally minor and the surgery is considered to be safe. After ear lobe reduction surgery, patients will need to wear a bandage on their ears for a few days. They may also experience some pain and swelling, which can be managed with over-the-counter pain medication. Most patients are able to return to work and normal activities within a few days of surgery. However, it is important to avoid strenuous activity for about 2 weeks. The results of ear lobe reduction surgery are generally permanent. However, the ears may continue to shrink slightly over time. If you are considering ear lobe reduction surgery, talk to your doctor about the risks and benefits of the procedure. They can help you decide if this is the right option for you.